Welcome to Community Conversations. I am Queen Miss Ebony J. You're listening and watching 1230 The Buzz Girl Talk Station, 101.1 The Wiz and 100.3 Cincy's R&B station. It's always a good time coming in on a Sunday to talk with you all. If you've never listened to Community Conversations before, this is where we come to talk about things happening right here in our community and how nonprofit organizations are truly making a difference. And I'm excited today because I'm joined by a beautiful queen, Miss Ashlee Young, who is the Vice President of Policy and Engagement at Interactive for Health. How are you doing today, Queen?
I'm doing amazing. Thank you so much for having me on.
Oh, yes, it's always a pleasure when we get to talk. Tell me, for those who are not familiar with Interact for Health, what is it that you all do?
Yeah. So Interact for Health, we are an independent health foundation. And so we service 20 counties covering parts of Southwestern Ohio, Northern Kentucky, and Southeastern Indiana. And so we're really serving as the catalyst for the community by promoting health equity and justice through grants, education, research, policy, and engagement.
So what are some things like you all do to help other businesses?
Yeah, give out money. I think that's one of the biggest things is that, we're able to provide funding and also just technical support and helping to just move our community in the right direction and making sure that we have a healthy and thriving region. And so I think that that's probably what we're most known for, is being able to provide grants out into the community.
Now, what is your strategic plan focuses on? Because I know you all just changed it up for us.
Yes, I am so excited about our new strategic plan. And so essentially last year, we spent most of last year trying to figure out, what does this next strategic plan look like? And so we talked with a lot of stakeholders, we talked with community members, really asking them, what are the most pressing issues within our community? What role can Interact for Health play in really making sure that we have a healthy region? And so out of that planning process, we really landed in two kind of focus areas: advancing health justice and mental health and well-being. And so with advancing health justice, we really know that we see that as a strategy area, but also core to who we are as an organization. And for us, advancing health justice means just taking equity a step further. So equity is about really giving people what they need and not thinking that everybody needs the same thing.
Right.
Justice is really taking things a step further and saying, like, how do we create more equitable systems? And so within advancing health justice for us, it's about community power building, policy and systems change, and also narrative change. So community power building for us is just like, how do we support more initiatives where everyday people, residents, and organizations that are supporting residents are really leading and deciding? I think as a society, a lot of times things are kind of top down. People up top are telling people what they need. But for us as an organization, we recognize that those closest to whatever the issue is are really the experts, and they should be driving the conversation. And so how do we support more initiatives that have community leading and deciding? And then policy and systems, we really want to say, like, how do we have transformational change in our community? In order to have transformational change, we have to change how things are operated. And things are, bad practices are just kept in place by bad policies and different practices. And so how do we support organizations and really trying to change policy and how things are operated? And then under narrative change, it really is about, how do we start to change how we talk about issues? A lot of times when we talk about, for instance, like poverty, is really from a charity mindset that, oh my gosh, somebody's giving people money or what have you. But like, how do we take a step back and really understand the root cause and how do we get here? And then on another note, how do we allow people to tell their own stories? Again, oftentimes somebody's interpreting something and we're not asking the person whose experience it is to really tell their story. And so those are our key areas under advancing health justice that really extend throughout our plan. And then the issue area that we heard a lot about was mental health. We know that even prior to COVID-19, many people in our community were facing mental health challenges, but that's only been exacerbated by COVID-19. And so for us, it's like, how do we help shepherd and make sure that our community is healthy from a mental standpoint? And so we're focusing in on youth because we know they have been drastically impacted. And really with the youth focus, how are youth leading in this space too? So how are they telling us what they actually need? need and how are we supporting those type of initiatives? And then also looking at the infrastructure of the mental health systems and how do we make sure that we're changing the system to really serve the people that need this access the most. And really, so that's our plan, advancing health justice and mental health and well-being.
I love it. So basically organizations that have the same goal, right?
Yep.
That could provide mental health services or, that policy part, they are the ones that should apply for the grant because that's who it's for.
Yes.
It's to have the resources to be able to continue doing what they're doing.
Exactly.
Now, I hear all the time people talk about there's grants out there, there's money out there, you should apply. What are some things or advice that you have to people that try to apply for grants? How do you really get it?
Yeah, I would say that we have an amazing team at Interact for Health, and we are really about just trying to make sure that our grant processes are easy. We're asking the right questions. We're not asking a whole bunch of different questions that aren't going to help inform decision making. And so currently right now, we have 3 grant opportunities available for people. We have our mental health equity RFP that's out. They're advancing health justice and amplifying youth voice mental health RFP that are currently available. And so people can check out our website at www.interactforhealth.org. Again, that's www.interactforhealth.org. And so on our website, people will be able to see more information about these RFPs and reach out to us. We've been hosting office hours in the community where people could just come and meet us and really just ask any questions about their proposal. And so if people check out our website, reach out to a team member that's listed under any of these RFPs and just ask questions. If you're writing an application or if you have an ideal and you're like, oh my gosh, like, is this something that we'll be able to get grant funds for? Please reach out. No question is a dumb question. Like, we welcome all the questions and all the ideals that people have. Again, our goal is to make sure that we have a healthy region. In order for us to have a healthy region, it really takes all of us being innovative, creative, in how we're trying to approach these issues that are challenges that our communities are facing.
Now, Ashlee, tell me this, because I heard you say health justice and health equity. What is your idea of health justice and health equity?
Yeah, I mean, I feel like for me, we oftentimes have this picture that we put up, and it's of a baseball game. And we have people that are at the baseball game, and some people need different kinds of support in order to see the game. And so within the community, a lot of people are talking about health equity. This is not home equity, not in your house, because some people get confused, like the equity in my house, not the equity in your house. The whole notion of equity is like giving people what they need. Oftentimes as a community, we have a tendency to say that we all need the same thing. And that's not true. We all do not need the same thing because we're all starting at different points in life, in society. And so the whole notion of equity is just giving people what they need, and not trying to have things equal. And the whole notion of justice for us is really breaking down those systemic barriers that are keeping inequity in place. And so some of those systemic things are like racism, discrimination, and those practices are held in place by inequitable systems. And so how do we start to advance health justice? By really addressing these root causes. And so for us, even at Interact, we have a very expansive view of health. Health for us is really more than healthcare. Healthcare only makes up 20% of someone being healthy. The other 80% of that is, do people have jobs? They have transportation, housing. And so for us, when we think about advancing health justice, is really addressing those root causes from a systemic standpoint.
So how does your organization make sure people have housing or jobs or food? Mm-hmm. That's what it's about when it comes to the health equity part.
Yeah. And like for us, really, we're, the issue that people are trying to solve within these RFPs, it doesn't matter so much for us for the advancing health justice, it's the process that they're going through. So whatever issue you're looking at, how is community involved in that? how are you addressing the root causes, and how are you telling the story about that issue? And so whatever issue you might be trying to address, that's fine, but what is the process that your organization is going through in order to address that? And that's what we're really saying, is that the process has to change. No longer can things be top down, it really needs to be bottom up. And so how are your efforts really supporting this different process of addressing these issues?
If you just tuned in, this is Community Conversations on 1230 The Buzz, your talk station, 101.1 The Wiz, and 100.3 Cincy's R&B station. I am Queen Miss Ebony J here talking with Miss Ashlee Young, who is here representing Interactive Health. She is the Vice President of Policy and Engagement. And if you're just tuning in, Interactive Health's goal is to make sure that our communities advance health justice. Now, we've talked about what that means, what it looks like, and all the different things that the Interactive Health does, whether it's community power building, policy and system changing, or helping you get grants. The whole goal is just to make sure that you are advancing and helping with, like she said, changing the process of the health status of our community. Tell me, why do you feel this work is so important right now? Because there's so much going on, Ashlee. And I feel like what Interactive Health is doing is really providing these organizations with the true resources that they need to make sure the work is done.
Yes, and that's exactly what we're doing. I think what I'm most excited about and what we heard about during our listening time is that, you know, traditionally in the past, we've been very prescriptive, that you had to do X, Y, and you had to be focusing on this very specific issue. And sometimes that issue is not the issue of today and is not evolving. And so for us, I think what makes this the right time is just, like you said, the environment that we're in. I think, you know, we're not completely out of COVID. We're in this new life as we're at the tail end. And so I think that for us, we really want to be able to be responsive to the needs of the community. And so I think that this is just the right time, just given where we all are as a community, and really just reimagining what does it mean for our community to be healthy and thriving for everyone, not just a select few, but everyone. And I think because of when I think about the mental health challenges, like COVID, it has impacted us all. And so how do we make sure that we're creating an environment in a community where we're supporting mental health and we're not having the stigma associated with it?
Well, you know, we haven't been outside that much.
No.
Because of COVID. So I think even thinking about opportunities of how we can get people back outside and, you know,
connecting.
Because that's what I wanted to say, Queen. They're back outside, but you still look up and everybody's on their phone.
Yes.
So the interactive part is missing. And it's about figuring out again, how do you, like you said, solve those problems and solve the health status of our community. How can community people partner with Interact for Health? Is the grant the only opportunity to partner, or are there other opportunities?
Yeah, I mean, I think the grant is one way, but again, if you have different ideals that you want to put in place, just reach out to us. Like, we are very open and available for people. And I would just want to call out that the opportunities will be open for a little bit longer. So our mental health equity RFP, which is really focusing in on improving culturally competent care. That RFP, the deadline for that is April 25th. And then our Advancing Health Justice RFP, the deadline for that one is May 9th. And our Amplifying Youth Voice RFP, which is really focused in on providing funding to youth serving organizations to help develop their organization capacity to amplify youth voice to improve mental health. That deadline is May 23rd. And so I would say just reach out to us about these RFPs or any type of ideal that you have. We also have a really robust data and learning team as well. And so if you're looking for data, you know, you can reach out to us. On our website. We actually have a link to a tool called Policy Map. And so if you're looking for data for your RFPs or grants that you might be working on, check out our website. And so I think that, you know, while we're a grant maker, we also want to be in service, whether that's in a research and data and learning capacity for our community.
And I know, isn't this the National Minority Health Month?
It is National Minority Health Month. Yes, April is National Minority Health Month.
I saw that you all posted that on the site. Were you all doing any initiatives around it?
So we're not doing anything specifically, but wanted to just call awareness. I think the other piece that makes our strategic plan unique this year too is that we have priority populations. And so realizing that health is not created equal, and we have a lot of disparities in health. And so within this plan, how do we make sure that we are working to close these gaps? And the way that you work to close gaps is really being intentional about the populations in which you're working with. And so we have a call out within our populations to really look at the Black community, the Hispanic community, LGBTQ plus community, low income family and children, and also our rural communities. And so I would say that, our focus in these priority areas is how we're elevating some of the issues.
Okay. So if we want to learn more, how can we connect? And I know you mentioned office hours. How do we get to find out where are you all going to be based at in the community?
Yes. So if you visit our website at www.interactforhealth.org, again, that's www.interactforhealth.org. You'll go to our open funding page, and then you'll see the list of RFPs and also contact information for our team members.
Yes, and it's all there. Everything you need is right there. What I love about Interact for Health is that they don't just give out the money, but they help you get the money. So you're not just applying for a grant. I'm telling you, I've been so frustrated. I've applied for over 100 grants, haven't heard one thing. But I think it's about us understanding, like you just said, there may be a process, a proposal. I didn't even know nothing about proposals or presentations, right? I'm just filling out the application. So it's about the knowledge. If you're listening now and you've heard something today, you have an organization that can possibly fit under one of these categories and needs some assistance, it is very imperative that you go to interactforhealth.org so that way you can get that support that you need. Like she said, if you have any questions with applying or which category you should fall up under, they are there to assist you, because the whole goal is that we are changing the status of the tri-state's health. And right now, our health is not in a great place. It's a lot of things going on. So this is your time to step up for your organization and really, really do something different. Ashlee, before you go, tell us, just remind us in case, they came in and caught that tail end of this conversation. Remind us why this is so important and what this new strategic plan is really focusing on, how it's going to help.
Yeah, it's really important because I think that when we think about, we've been trying to solve a lot of these issues in our community for years, whether that's gaps in education, whether it's trying to address poverty. And I think that we need a new way of doing things. And so this work is really important because we are centering community and people, and we're also trying to do the hard work of changing how we operate. And so I think that the work within this new strategic plan is very intentional. It's centered around community, and it really is a partnership. And we realize that being in a foundation, that we are oftentimes in a position of power and privilege. And so we are committed to leveraging our power and privilege as a funder for the good of our community. And we want to be held accountable for that too. And so we are all on this journey together. And I think that what better time than now?
I agree. This is the perfect time. Like she said, we outside. The babies are moving around. The parents are moving. Everybody's moving around, but the health status has not changed. So we need to change the status because the summer is coming and differences can be made. Your organization can make the difference, but you just need to step up and go ahead and apply. Interact for Health again. Thank you so much for coming on the show and telling us opportunity, Queen.
Thank you.
And again, they have 3 different grants. The first deadline is April 25th. So if you have that mental health, culture care, that's your thing, you might want to go ahead and get on the website right now. The other applications deadline is May 9th and May 23rd. Again, interactforhealth.org. Make sure you log on. This is Community Conversations. Thank you for coming, Ashlee.
Thank you. Thank you for having me.
You are listening and watching 1230 The Buzz, your talk station, 101.1 The Wiz and 100.3 Cincy's R&B station. I am Queen Miss Ebony J, just making sure you get the plugged and get connected to the community. So do not miss out on your opportunity. If you have an organization and you want to come on, you all are doing something great, you can slide in any of my DMs on social media, or you can simply send me an email to Miss Ebony J at radio-1.com. That's MSEBONYJ.com. This is Community Conversations. I'll see you next week.